at 3:30. So glad they always remind me it's in progress. We are going to call this meeting to order at 3:30. And Lindsay, will you do a roll call, please?
Rochelle Woods.
Present.
Sarah Lampy.
Present.
Harriet Hall.
Present.
Blaine Drager.
Present.
And Sherry John.
Present.
And a quorum has been established. Thank you.
Thank you. And I will just let everyone know that the very first order of business at 3:30 is where we will be going into an executive session. And Jean Biondi is going to stand in for Carrie today. She is out. And so Jean, I'm going to turn it over to you to take us into the executive session, please.
Thank you, Sherry. Yes, the basis for the executive session is CRS 246402-4B, specifically legal advice concerning 2835 Southeast Grapevine District Court enforcement. Would you like me to make the motion, or do you make the motion?
We'll make the motion. Maybe I get a motion, please, to take us into the executive session?
I'll move to go into executive session for legal advice.
I'll second.
Second. Okay, we have that and a second. I believe that was Harriet. All those in favor, please say aye.
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 I guess I should say anyone opposed. Hearing none, we will go into the executive session, and then we will be back at 4 to do the business portion of the public health meeting, the Board of Health meeting.
Thank you. Yes. Now that we're recording again, I realized when we went into executive session that I stated only one of the two topics that we discussed. In addition to the 2835 Southeast Grapevine District Court enforcement, we also just provided legal advice concerning 625 Loveland in Golden as well. So I just want to update the record so it accurately reflects the topics discussed.
Thank you. Okay, we will begin the general portion of the meeting, of the business meeting. And we did take roll beforehand, so we don't need to do that again. And we do have some language justice folks with us, Andrea and Luz. So one of you, please proceed. We're glad that you're here.
Thank you. Good afternoon, everybody. My name is Andrea. I'm here with my colleague Luz, and we're here with the Community Language Cooperative. Thank you for committing to practice language justice in this space where we can speak and hear in the language of our heart or how we feel more comfortable. We're going to have simultaneous interpretation in English and in Spanish. And once we turn on the interpretation, you're going to see a globe that is going to come up at the bottom of your screen. Or if you're on your phone or tablet, you're going to see 3 little dots where it says more. Please make sure that you click it and select your preferred language so that you can fully participate of this meeting. Please remember to speak at a conversational pace, to remain muted when you're not speaking, and speak close to your microphone when it's your turn to speak. If at some point you're speaking too fast or we need you to slow down, I'm going to turn on my camera and I'm going to make this sign that just means stretch your words so that we can catch up. It happens sometimes, so stretch your words. Hola a todos, mi nombre es Andrea, estoy aquí con mi colega Luz y estamos aquí con la Community Language Cooperative porque vamos a practicar la justicia del lenguaje para que todo el mundo pueda hablar y escuchar en el idioma de su corazón. Tendremos interpretación simultánea en inglés y en español, y una vez que aprendamos la interpretación, van a ver un globo que va a aparecer en la parte inferior de su pantalla, o si están en su teléfono o tableta, van a ver 3 punticos donde dice más. Asegúrense de hacerle clic en alguno de estos 2 espacios y seleccionar su idioma preferido. Recuerden mantenerse en silencio cuando no estén hablando, hablar muy cerca a su micrófono cuando sea su turno de hablar y hablar a un paso conversacional cuando estén hablando. Si en algún momento están hablando muy rápido, voy a prender mi cámara y voy a hacer esto que significa estiren sus palabras para nosotros poder desatrasarnos e interpretarlo todo correctamente. Si tienen alguna pregunta, pueden hacerla en el chat. If you have any questions, you can ask it in the chat and we can begin interpretation now.
Thank you. Okay, if everyone will find their little world at the bottom and choose your preference. Okay, let's jump right into the meeting, and we have consent agenda. Are there any items that need to be removed that the board members would like to discuss from the consent agenda?
I would like to pull the fee schedule off for further discussion.
Okay. We will remove that and put it into the regular discussion. We can talk about that. Anything else that needs to be removed that a board member would like to have further discussion on? Okay, with the exception of the fee schedule, may I get a motion to approve the consent agenda?
I would
With-
so move that we approve the consent agenda with the exception that was mentioned related to the fee schedule.
A second, please.
Second.
Okay. All those in favor, please say aye.
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 Aye. Any opposed? Seeing none and hearing none, that passes. Let's see. Lindsay, what is the protocol to immediately, can we immediately discuss the fee schedule, or should we move it down into the,
No, I think you can immediately.
okay, that's what I was
Yep.
getting ready to do, but I want to be right. Okay, let's go ahead and can someone maybe pull the fee schedule up? Or Lane, are there specific questions you have on that? I'm going to let you take the lead on this.
Sure. I think I've brought this up in the past. For me, I just want to better understand the fees. So we just see a proposed fee. I don't have a good understanding if in some of these, is it equipment costs increasing? Is it truly recovering our costs? So have we built in all of our staff time and salary? Like some of these might be the vaccine costs went up, or the, some of the different things. So it's a broad, medication, but I just want to have a better understanding that where we can be getting cost recovery and it's appropriate, we're doing that. And if not, because of client ability to pay, we're making conscious decisions to lower the costs, that's fine. But we are also calling that out so we understand what it truly costs us versus what we're actually charging. So just getting a better understanding of all the different fees that we're setting, and that we are, where we can, getting our cost recovery, because I know that our budgets are continuing to get strained, and this is one of the spheres where the board does have a role to, bring in revenues and make sure that we are covering our costs where it's appropriate. So just get a better understanding of that, because I haven't really seen that in the fee schedule. I just see current fees and proposed fees and a little bit about what the fees are. So just trying to get a better understanding.
Those are good points. Is there anything in particular that you would like them to bring up today? Or you just wanted to ask them to make sure that's done in the future, or what?
I feel like I've asked for that in the past and I still haven't seen it. So I don't feel comfortable personally approving the fees until I see that, because I gotta have a better understanding of
Okay.
where we're at and what cost recovery we're actually at. If it's full versus partial, so that I'm making a conscious decision to get less than cost recovery where appropriate.
Understood. Is there someone that would like to, Jim, I saw you jump on with your picture showing up. Do you have something to add, or Dr. Story? One or the other?
I just
I'll
wanted to be
start.
prepared to answer if there was a question.
I'll start, Jim, because I think some of those fees are clinical fees too. And so
It's across.
what I think will be, what we can do is we can do a little editorializing for the fees. It is December, so these are 2024 fee schedules. But if we can squeeze that into January, I think we'll be okay. As you know, you're a public health practitioner. Some of those fees are set by the state. Many of the fees related to our clinical services, our vaccines, where we get grants from federal or state entities. We do not have a say over that, but we can at least highlight that for you and say, these fees are changing because of XYZ. These fees are changing because of this state statute. change. We will never recover our costs ever on any fees. If we did, our fees would be $150 a patient. In the clinic, I know Max probably is on here, wants to jump in, but I can tell you, I can give you a little more information if you give me time to prepare it. I've seen it on the proportion of our costs that are covered by fees versus county general fund versus grants versus miscellaneous. It's not perfect cost accounting. It's not like, it's not easy to, as you know, account for labor and capital percentage for different fees. I'll let Jim speak to environmental fees, and then vital statistics is also regulated. So there's just a lot that we don't have control over, or that we'd have to go to voters for if we wanted to increase above and beyond anything else that we're already doing, as you're aware. So we can go line by line on those fees. That's not a problem. And just give you a little more transparency into that as best we can. So, and then I now will turn it to Jim, because I didn't want Jim to have to speak for all the fees. Jim is the expert in his fees.
Jim, would you like to add something?
Sure. Thank you, Dr. Story. I would just like to, on tab 7 of that fee schedule we've made a number of adjustments this year to our land use review fees. And it's really been our goal over the last few years to collect data from our Amanda database to help us understand how much time is actually going into review of land use applications, specific types of land use applications. And our data is getting better and better. And this is based on an hourly rate. The last time I think we calculated an hourly rate for the county or for the health department, at least for my division, was about 2 years ago. And so the time element that we've been able to determine based on a $75 per hour hourly rate amounts to what you see here on the tab 7. So those adjustments, we've been kind of gradually ratcheting them up as we get better and better data to help us to really at least recover the review time associated with land use applications. And for the benefit of the rest of the board, we do land use review for various types of land use applications in conjunction with the planning and zoning department's review of land use applications. So these fees get added on top of land use fees that are charged by the planning and zoning department to landowners and prospective developers and so on. Not that we're trying to save those folks money, but I think our fees are relatively close to what we're spending in terms of average time per application review. And then on tab 8 there were a few other changes in our inspection fees, which the board has approved in the past. I made an adjustment to change to a per inspection fee on child cares and on swimming pools this year, because we haven't been able, because of lack of funding or resources, we really haven't been able to get to all of our inspections. So it didn't make sense to charge a swimming pool owner $300 a year if we were only getting to one inspection. So we were able to determine that it's on average roughly a couple of hours of time, including admin time, and I should say that in that $75 per hour fee, there's indirect is added into that. So we're covering indirect and direct costs associated with the actual inspections of those facilities. And that's what an inspection fee, in my perspective, should cover. If the board feels that it should cover additional elements of our program, then I need to understand that. But I believe the statutes are pretty clear, is that we can recover direct and indirect costs for environmental health services that are provided. So, and I think it's a reasonable fee for a couple of hours of work in a facility to charge $150. And I did mention make it a change in the fee schedule that for higher risk childcare facilities where we by standard operating procedure, do 2 inspections per year. For less risky or lower risk facilities, we do 1 inspection per year. Swimming pools, we will do up to 2 inspections per year. So, I think it's pretty clear we're gonna raise more funding or develop more funding if we can stick to our SOP and do the numbers of inspections that we feel need to be done based on our risk characterization of those facilities. And then the last one was that a couple of on-site wastewater fees, that the component permit application highlighted on tab 8 there. It was just an adjustment. That was an oversight from last year to modify that fee $60 to really be closer to recovering full cost of that permit, the activities associated with that permit. So from an environmental health program perspective, I think we're getting better at understanding what the cost of our actual services are, but I would tend to agree with Dr. Story that it's not likely that we would ever collect 100% of or recover 100% of our costs.
Thanks, Jim. That's helpful.
Oh, I'm sorry. Do you have questions of Jim?
No, I think that's good. To me,
Okay.
it's understanding what our costs are so that when we're setting fees, we understand where we are deficient. That's to me the kind of the crux of it. And then all the proposed changes, having at least some idea of why, like some of the medication, I'm guessing it's the medication increase, but I don't know. So it'd be just nice to have that. Maybe that's the next tab next to proposed fee is here's just a brief understanding of why these fees are changing. So
Yeah,
we
that would help.
Do you want that for the fees? Max can speak to some of these and we'll make sure I have it open in front of me and lots of highlights. Do you want that kind of editorializing around fees that have gone down or just fees that have gone up? Do you want to just to understand that?
For me, it would just, any changes would be helpful to understand. If for some reason there's a reduction, that's probably rarer than increases. Just why we're making that decision. If our cost really did go down,
probably not.
This helps me.
It's about 50-50. It's about 50-50 on the clinical side that fees have gone down and up because of like fluctuations in kind of the regulated fee structure for some of these highly regulated issues. So we can give you more insight in that. And then I think to expedite the fee approval so we can get to work on collecting revenue, we can do January, I'm assuming, for approval retroactively. Jim has his hand up. Maybe that's not possible. We could split up some of these fees if there's more things you want to approve, so we can get things rolling. But I don't know the logistics or specifics around what would happen if we don't approve them in this meeting. But I will say that I can definitely get you more insight. I do want to I'll turn it back to you to call on others because I see that other people had their hands up who are subject matter experts in these fees. So I'll go on mute now.
Joe, would you like to jump in?
I just want to make sure that time will allow for further discussion, but also if there is in support of moving the vote forward today to approve the fee schedule. I'm happy to do a general overview very quickly. Lane, first and foremost, thank you for your question. I am aware that the board has asked for further details, but as you can imagine, there's many layers to this fee schedule. There are several tabs, there are different areas of focus, so it's hard to really dive into the details. I think Jim, of course, has a real good handle on those fees associated with environmental health services. I will say that a lot of these fees are indeed based on what we can recover, what is suitable for our community. When it comes to procedural items or procedural costs, those are specifically tied to Medicaid rates. Those are our reference points. However, although we go through a cost analysis on a 3-year basis to look over those procedural codes, there is some flexibility on what we can and should be providing or what we should be charging those individuals that come to JCPH. For our lab visits for other areas of medication, those align with where the market is going with those medications. So there is a percentage of a markup. Unfortunately, I don't have that percentage. The immunizations, of course, that also is tied to the services within the division. And our vital records team, of course, that is indeed an area in which we do recover almost all of our costs. So those have some regulation over those fees that we could charge the community for those certifications. I believe that is state regulated. So I guess really what I wanted to highlight is that this is an intensive process that is over the course of several months. Getting to this point on what we present to the Board of Health, there is an understanding and a balance between what we can recover, what we should be recovering, and how we can best offer these services within the community. So I'm happy to give the floor back. I'm happy to dive into any specific details, but I want to assure the board that this is not something that we take lightly. This is something that involves a tremendous amount of discussion. And although we do intend to move forward with a fee schedule for a fiscal year, their opportunities do arise where we can receive additional funding, where there are it is necessary to revise these schedules or portions of these schedules. So I do want to emphasize that this is indeed where we are at with the fees that we intend on collecting when we move into the new fiscal year, but there are opportunities to revisit this either within a study session. If there's anything in particular we need to focus on, I think from that standpoint, it's hard to give not enough details or too many details. So thank you for this opportunity.
Dr. Story, you have your hand up, and Max, I also saw your hand up and then it went down. Do you want to put it back up?
He was probably intimidated by my hand going up and worried about what I was going to say. I do have one thing we can share with you. I can make sure it gets sent to you, which Sarah, who's a supervisor in the clinics, shared. She's on the board meeting in the public area. It's actually very helpful, Lane. I think this will help for the vaccine part of it, which is the CDPHE fee schedule, our fee schedule last year, our fee schedule this year, as well as kind of the state, or the market rate for those things. So you can compare what the state charges, what we charge, what the market rate is for those, and then any sort of comments as they were developing the vaccine fee schedule that I think it's really it's very informative and very simple. So big props to that team for creating this as they were making those decisions, but we can definitely share it with you. And I think with all of you, I'll make sure Lindsay can get it to all of you. So that will help you see where we're quite different or where we're not.
That would be helpful. Max, I see your hand again.
Thank you. Yeah, I'm on my mobile device, so it keeps automatically dropping it for some reason. But pretty much everything that the rest of my peers have touched on is accurate. Very extensive process, not something that we take lightly at all, and that is why we have such an intensive calculator and look at all of the market prices to be as fair as possible, and to also maintain and make sure we're not cutting our legs out from under us too. And then there are also those built-in costs that we get them. They are supplier costs. We can do nothing to change that. And then again, there is the fluidity of Medicare and Medicaid. So it's multiple fronts. It's an amalgamation of a lot of people's work, a lot of people's expertise, and a lot of different markets that we're working with. So happy to shed a light on it. But as Joe said, and as Dr. Sorish said, it is not a quick process at all, but I would be happy to work with the teams if you need further information. But that calculator is a prime example that Dr. Sorish was just talking about, of how we do calculate those costs and track them over time and make sure that we are doing our due diligence.
Jim, I see your hand up.
Yes, just the last note, logistically, it's important for us to pass or get these fees approved as soon as possible, because we also have to make adjustments to the database in order to properly insert the charges that we and the planning and zoning department apply to new applications. So if we delay till mid-January or late January, it's likely we won't be able to begin assessing these fees until February. So I've got it set up, or my staff has it set up, I should say, to alert planning and zoning should the fees be approved today, to make the appropriate adjustments in the database so that we can begin charging those fees on January 1st.
Thank you.
Yeah.
Blaine?
And I appreciate all that. I think that's been the situation sort of year in and year out, where I felt, yep, I don't want to hold things up. But every year, to me, it's just that even that high level of just highlighting within your fee structure, these are all the ones that are either set. I'm familiar with some of Jim's world, but I don't know all of them, of which ones you don't even have control over. That would be helpful to be highlighted in here. Also, again, just to see, we know we're not recovering costs, highlighting that so that as a board, we're aware of that, as well as even some of the ones you don't have control over, because those are advocacy points where we need to be pushing to say, hey, we know Jefferson County Public Health is not getting the money they need to run many of these programs at the funding levels that are being set, so that we can advocate. You know, I know for Jim, the restaurant fees are going to be a point of discussion next year, hopefully for the 25 legislative session, but sadly those are set in statute, and that's how those fees are set, and that's a very difficult process to change. So, but understanding more of that, and I don't know how much the rest of the board wants or knows all these things, but I think it just would be helpful, especially even as we're making changes. You know, hey, we are able to make this, you know, our costs have gone up by this amount, and we're trying to get cost recovery or balancing. We know it costs a lot more, but our clients' ability to pay is going to be a significant barrier. And just so we are more informed in making the decisions, to me, just having a little more context would be helpful, versus it is a pretty big spreadsheet with just a whole bunch of numbers and trying to make sense out of it, even though it's highlighted where the changes are. I don't have a good understanding of why, and also especially when things go down, that would be it's always a surprise to think our costs dramatically went down. So anyway, that's the larger context of why some more information is helpful for me in approving it.
Okay. Further questions or comments? Lane, and I am going to, because I want to honor your questions and your concerns. I think they were really, really valid. You know, the other point that I would make to that is, you know, we have a lot of people ask, why do you charge what you charge for, you know, inspections in the restaurants or whatever? And the board needs to be able to answer those questions. But I want to know if you think you have enough information. Would you like to see this moved to January? I want to respect your concerns.
I feel like certainly Jim has given me better insight on, you know, his changes. Some of the others I don't. I have, I guess Max shared, they have a calculator. I'm not sure exactly which tabs Max was speaking for. But yeah, just in general, I think that would be a way to improve this, is at least some kind of commentary on the fees. Like these ones are locked. So again, don't expect to see these changes unless there's statutory changes for them. Other ones, yeah, we've always kept these at market value. That's helpful. Again, all the information you're sharing is more insight, because I've not really gotten that in years past either. So again, I felt like I've asked this question multiple times and we're always under a gun to get them approved. So I don't want to delay that, yet at the same time, my concerns still hadn't been addressed. So just wanted to really make sure. And again, maybe the rest of the board feels very comfortable and understands these a lot better. But I don't understand a lot of them.
So you want this to go to January agenda?
I'm not saying that. I think you can go to a vote. We have
Okay.
five board members. So
Right.
I have a quick question, Sherry.
Yes, Rochelle.
Yeah, just in scanning this over, I'm aware that we have skilled and qualified lactation consultants in our clinics. And I'm not finding anywhere on here where we charge for like lactation support or lactation counseling. Is that on here, or maybe it's not supposed to be on here? And are we charging for that? And
We do
that's just
that
a
via
question.
WIC. We do that via, so that's in the WIC program, so that's gonna be all in on WIC. Alex is on the call as well. She's division director for family services. She can illuminate
Okay.
what we
Yeah, I just
do
didn't, I don't
charge
see it under
fees.
WIC.
So, well, WIC is a federal program, like a benefit program, so we wouldn't be charging anyone anything fees when they walk in for those sorts of things, because they are it's comprehensive with part of the program, the federal like nutrition program. So Tatiana is also on the call. Lucky us, she's head of WIC, so she can talk to more about like what that means when we say fees in WIC versus like what's part of the WIC program. Tatiana.
Thanks, Dr. Story. Yeah, Rochelle, thanks so much for the question. So historically, if we've ever gotten any referrals for lactation services for clients outside of WIC, we have just provided those as needed with the clinic. We have not charged for those services historically. And we would continue to do that so long as there is a need. If there was ever an interest in the clinic wanting to expand and having a larger lactation support system, that is something that I would be more than happy to discuss with them, and we could look at funding streams and things for that. But since vast majority are covered by WIC, and the amount that we're doing outside of WIC is so small that we have never needed to put any sort of billing codes in for that specifically.
Awesome. Thanks, Tatiana. I just wanted to make sure I know it's a valuable service. So I just wanted to make sure that, if possible, that, we're charging if we were able. So thanks for that explanation. I appreciate that.
Thank you.
Okay. Let's see if we can't move this forward. One of the board members, do you want to make a motion to approve the fee schedule?
Before you make a motion, just real quick, if I could, propose a study session committed. I hear you, Lane. A study session in January around more than this, which is how fees relate to our overall kind of like budget composition. We can take that division by division so you can understand the role of fees or the unimportance of fees sometimes in different teams. Just a high level understanding grants versus county funds versus fees, and any sort of extra information about the fee schedule. We can definitely also get you offline between now and then. A vote would be great because then we can move forward. But I do commit to you a study session because I already planned on January, because we've talked about this in the director's report. We're going to start our 2025 budget discussions very early this time around because we have some impending issues that we need to deal with sooner rather than later with this board. So this could be part of that, and just committing to never putting a fee schedule in front of you again without at least a summary of the changes you're going to see proposed and why. And I hear you all loud and clear on that. So I take responsibility for kind of plopping that on your desk. And I appreciate you taking more of a fine-tooth comb with it. It's a good challenge to us, right? To not just do things the way we've always done them. So thank you, Lane.
Okay. Harriet?
So I would make a motion, and my motion would be to approve the fee schedule as distributed with two caveats, one being the workshop study session that Dr. Story has recommended, which I think will be very helpful. And the other being the promise that she has made that next year when we get the fee schedule, we will get it either at the time or I think preferably in advance of, with the kind of background information and explanatory information that we've talked about and highlighted in this discussion tonight, this afternoon.
Okay, we do have a motion. Do we have a second?
I would second that.
It has been a second by Rochelle. Okay, all those in favor, please say aye.
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 Any opposed, please say no.
I'm going to abstain.
Okay, we have 4 aye and 1 abstain. And with that, we will move on into the rest of the agenda. Public comment. I don't believe we had anybody sign up
You
to
share.
give public comment. Yes,
Sorry to interrupt. Was there, just point of order, is there a motion made to approve the remainder of the consent agenda? The other 4 items?
we had already approved those.
Those were approved. Okay.
Yes, we did approve those.
All right, great. Just
And then we went to discussing the other one. Thank you.
sure, carry on.
Okay, thank you. I don't believe, Lindsay, anyone had signed up for public comment.
Correct.
Okay, so with that, we will move to the next item, the financial report. Salma, I see you have signed on.
You are muted.
Hello, everyone. Can you hear me and see my screen okay? If I can get a thumbs up, that would be great.
Yes.
Awesome. So today I will be presenting the November financial statements. And as of this reporting cycle, with 91% of the year complete, our total revenues are being reported just where we expected them to be, which is 81% of the annual budget. As I mentioned during the prior months, we did not utilize approximately 1.8 million of our COVID-related revenues, primarily due to our ELC grant as we shifted from COVID response to COVID recovery, and also due to funders' limitations on what we can utilize those funds for. Our charges and services are being reported at 90% of the annual budget. And when it comes to our expenditures, we are also right where we projected to be, which is 83% of the annual budget. And again, this has to do with the COVID-related salaries and benefits, since we did not fill some of those COVID-related positions, and also because we shifted some of those positions to the county ARPA dollars, and therefore those expenditures are no longer reported under public health fund. Our supplies and direct assistant line items, we continue to surpass these line items as we shifted some funds from other categories, such as capital projects and equipment. We did not have any major infrastructure updates to do this year, so we shifted those funds to purchase computer equipment that were due for replacement. And intergovernmental charges are being reported at 100% of the annual budget. Cost allocation is being reported at 96% of the annual budget. And also our services, other services and charges or contractual charges are right on target with the budget. And as a result, we've utilized 7.6 million of our county transfer, or 88%. Although it might seem like we are 3% behind budget, we're not. That 3% is being reserved to offset approximately 13 days of an additional pay period of December, which will fall on January 1st. So we are expecting that the county will prorate 13 days of payroll and move it from 2024 to 2023. That's all I have for today, unless if you have any questions.
Thank you. Are there questions for Salma? I am not seeing any hands, but I'm not seeing the full screen of people. So if there's somebody that does want to speak, give me a shout. Okay. We need to approve the financials. May I get a motion to approve?
I'll move to approve the financial report.
And a second, please.
I'll second.
Okay, it's been seconded by Sarah. All right, all those in favor, please say aye.
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 Any opposed, please say no. Are there any that would like to abstain? All right. Seeing none, that motion passes and the financials have been approved. The financial report has been approved. New business. The first item up we have is the Gilpin County update. Dr. Story and Alyssa Witt and Ray Rears are going to give us the update. Dr. Story,
Yes.
are you going first?
I'll start. Lucky
Okay.
me. Okay, thank you. And I just, before the team gets to pop in here, and Jody is also gonna pop in. I just I want to publicly just thank Salma, because it's been a lot to transition into understanding not just our department, but the budget process, and of course Joe, but Joe is Salma's supervisor, but he's doing a great job mentoring Salma, but Salma is really, really bringing it in our conversations with the county and our conversations with other health departments, and trying to understand like what's happening next year, what's happening the year after. And she does not back down from a tough conversation, and that is really admirable. And so thank you, Salma, for just serving this board this year and growing in your career. And I'm so lucky to have you like on the team, because man, you've already caught some mistakes I've made and caught some things that I like might have overstepped, and I'm so grateful to you. I know we're in really good hands with you and Joe. So thank you for doing this for the board as well. And we look forward to like you leading all of us.
Thank you.
More. So
Thank
okay,
you.
got that out of the way. I'm very emotional today, very grateful and loving today. So you all caught me in a really good day. I'll start our new business by saying I came into this department and looked at the org chart and I said, who's that? Elisa, who's that? Why is she in that county? I didn't understand how we had an employee who also was a health coordinator in an entirely different county. And so I did a little digging, and then we ran into each other outside of the washroom at a statewide event. And I instantly knew I'm obsessed with this woman. She is amazing. She's a mindfulness teacher. We had so much in common. And I thought, I'm so happy to have her on the team, and then realized that actually this 15-year relationship that Jefferson County's had with Gilpin, where we've supported them, kind of logistically supported the health work, is now it's time to let them fly and let them grow and let them do their thing. And that is one of the most amazing things, to be able to come in at the tail end of this partnership and to witness it. And I had the pleasure of going up to Gilpin County and getting to meet Ray Rears, who's the county manager / Jeffco resident, which is very exciting. So he's one of ours as well. And to really just see the space, get recommendations for places to stay and things to do. I did make a booking at the casino that you recommended, so we'll be going there very soon. So thank you for that. But most importantly, I think this is not, as Ray has put it eloquently, this is not the end of something. This is the end of one season, but the beginning of like future partnerships. And to be peers in the space, committed to the same people, it means a lot. And we have a lot to learn from Gilpin County as it relates to like how we serve our mountain communities. And they have inspired me to think about what we do in the future differently. So I did want to give them both an opportunity to address the board. And then we'll just kind of cap it off. And Jody has some remarks before we move on to the rest of new business. So Ray, I'll turn it over to you. Are you sitting in the old courthouse?
I am.
Okay.
Built in
Great.
1900, the original one.
Amazing.
Yes. Well, thank you for that introduction. Really appreciate it. Really appreciate our conversations as well. Really, I'm here to express my gratitude to Jefferson County for 15 years of support of Gilpin County as we transition to this new relationship. We're really excited to move forward. Very thankful of the support Jefferson County has provided to Gilpin County. I'm also very thrilled to announce, though it's probably already out, that we have made the selection for our new public health director, and it is Ms. Witt. So we are looking forward to her role as the public health director for Gilpin County starting in January. So again, appreciate the partnership, looking forward to it evolving in the future, and I'll turn it over to Ms. Witt.
Thank you,
Alyssa.
Ray, and thank you so much. I have so much to be grateful for. The mentorship that I've received from so many members of the Jefferson County Public Health staff. I want to call out specifically Jody Irwin, who has been my manager for 2 years. Jim Rada, who has helped me learn the ins and outs of environmental health. Christine Billings for her support, especially during the COVID pandemic. I can tell you about one short little episode that was extremely impactful. We had a resident come down with COVID in my first few months of employment, and he was a kidney transplant patient who lived alone. And Christine stepped in and helped us get him a private ambulance to the VA hospital to receive monoclonal antibodies. I never could have done that without Christine and her team and the support of Jefferson County, literally saving lives. Thank you, Christine. I'm sure you remember that day. Yeah.
Very clearly.
So it's been, yeah, thank you, Christine. It's been quite the journey over these last couple of years, and I'm excited moving forward. I'm, very grateful both to the leadership here at Gilpin County and to the support I've received, especially from all the experts and all the support from Jefferson County. Sarah, I'm so thrilled that you're on board, and I know that you and I will be colleagues, staying in touch. We're neighbors, we're friends, and I just can't thank you all enough. So it's a wonderful partnership, but it's not, the partnership formally is ending, but the relationship definitely is not. So I just want to say that. Thank you, everyone.
Well, and congratulations to you. We're very happy, and we also look forward to the partnership. I think everybody all needs to work together, and I think that we do that very well. Yes. Okay, do I see any hands up, board members? Does anybody have any comments, questions about Gilpin? Is there more you want us to know, or just kind of an introduction?
I think Jody was going to wrap it up, but I don't
see. Oh, there he is.
There he is.
I'm on. Thank you so much. Yeah, congratulations, Elisa. I knew it was going to be you. I know it was a very competitive process as well, but great choice, Ray. Just wanted to say very early on, after Elisa started, she had a goal of creating a Gilpin County Public Health Department. And so we brainstormed a little bit, and she started by researching other departments of similar sizes, meeting with people from those departments, asking a lot of questions. She developed a plan, and she executed what ended up being a very complex plan that included a multitude of funding streams, new programs, hiring new staff, new policies, and building new relationships to support her vision. So very thoughtful, very organized, and she was the perfect person to do it, not only because of her background and experience, but because she has connections within the community. She lives in the community. So I'm just so thrilled that you could all find somebody that is in your community that has this background. So the future for public health is bright in Gilpin County. And Ray, of course, thank you for the strategic leadership and support to make this happen. It's a big accomplishment in a very short tenure as county manager. So way to go. Good job, everybody. Thank you.
Great. Thank you. Okay. We're going to get a progress update. The CHIP priorities and the process. Dr. Story.
Yeah, I'm still shook from that surprise announcement Ray gave us, like county manager gave us. I wasn't prepared to know that she got the job. So that's exciting. It's very rare to be surprised. And this is a good surprise. My team knows that I do not like to be surprised in these meetings, but that was a surprise that I appreciated. So I don't have a lot to update except we're on track. Just to remind you, we kind of gave you like an initial insight into the county health improvement plan priorities, either last month or the month before, which will be environmental health, economic health, specifically really focused on housing, and mental health, specifically focused on substance use disorder and suicide prevention, and like behavioral health care access. In the environmental part of it, we've done some expansion of those priorities to not just look at climate change as a threat, but to be more specific about even current state air and water quality, as well as potential like animal-borne disease, zoonosis, zoological diseases, things that come because the climate's changing and there's, pests involved. So we're, actually trying to put a little more teeth in that section, instead of just climate change generally, or thinking about climate-related kind of disasters, but actually making it a little more salient to people. So today. So more on that in January. We will be presenting that document to you at the January board meeting for approval, so we can get it over to the state for their files, because the state likes to have all of the chips from all of the different local health agencies so they can plan their own statewide health improvement plans, their SHIPs. So that's why it's important for us to get it to them relatively soon. So, but not a rush, not super urgent. So that's the update. If anyone has any questions for me or for that team, big thank you to Amanda, who you met, who was employee of the month last month. She's working hard. She is such a good sport about all of the comments that everybody's making on the chip right now, and she is moving us forward at a good pace. So I'm very, very happy with where things are, but happy to entertain any questions or comments.
Questions or comments? Okay, I'm not seeing any hands. Thank you, Dr. Story. Yeah. Okay, the next order of business we have, as we do every December, the Board of Health 2024 nominations and the election of, we need to elect a president, vice president, and secretary. And I want to open this by just saying how much I have loved working with everyone and getting to know people better, and just watching the excitement and the all the positive things that are going on. And I think Jefferson County has the best staff in the whole entire state. And I just want you all to know that I have just really loved working with all of you. That being said, I also believe in a strong team, and we've got a great board. I would like to share, because I think that it's always important that people get to do certain things on the board. Lane, this is your last term that you've been appointed to. And I would like to do a nomination to have you as the president for the next year. If you would accept the nomination, I would be very, very happy and would love to give that position to you. Although I would stay very, very involved. I don't want anybody to think I'm leaving. Not getting rid of me. So I would like to make that nomination. If you would accept it, I would take a second.
Yes, thank you for that. Appreciate it.
I will second.
Okay. There has been a nomination. There's been a second. Are there any other nominations for president? Okay, seeing none. All those in favor, please say aye.
Aye.
And it's okay for you to vote for yourself, Lane. Aye. Well, thank you very, very much.
Thank you.
We also need to vote for the vice president and secretary. Are there nominations for vice president?
I'd like to nominate Harriet.
Well, before I say yes or no to that, I would like to know if Sherry would agree to be vice president if she were nominated for that, because I think that might be the best way of her supporting Lane. But
I didn't know that was an option here. I thought that Sherry was saying that she was, kind of hang out with us, but not be president, vice president, etc. Oh, you know what? I'm just going to be quiet now. Looks like I'm getting ready to learn.
Well, I think Sherry needs to tell us.
Well, I would be thrilled. I love working with the board, and I've loved working with Lane. I love working with all of you. But I will certainly leave that decision to the board. I just wanted Lane to have a chance in his last term to have a chance at being the president of the board. I would remain very active as the vice president, and of course, do whatever the president asks me to do. But saying that, you'll need a nomination and you'll need a second and you'll need to go through that whole process.
Okay, so I will